The date is 2026-06-17. This is the Executive Lens. The biggest story today is the White House's move on childhood vaccine recommendations, a policy shift that could affect federal guidance, state-level coordination, and public health messaging. According to the White House document titled Realigning United States Core Childhood Vaccine Recommendations with Best Practices from Peer Developed Countries, the administration is aligning U.S. recommendations more closely with what it describes as peer country practice. The significance is not just medical, it is administrative and political, because federal vaccine guidance shapes how agencies communicate risk, how providers interpret schedules, and how families understand official recommendations. The practical question now is how the change will be implemented across the Department of Health and Human Services and related public health agencies. If the administration is revising the federal baseline, the next indicators will be whether the Centers for Disease Control and Prevention updates its materials, whether the Advisory Committee on Immunization Practices is involved, and whether the change affects school, insurance, or procurement guidance. For state and local officials, the issue is whether federal alignment reduces confusion or creates a new split between national recommendations and existing practice.
This also matters because vaccine policy is one of the clearest examples of where federal guidance, medical practice, and public trust intersect. Any shift framed as a move toward best practices from other developed countries will be scrutinized for what it changes, what it leaves untouched, and whether agencies provide a clear transition plan. The immediate story is not the science debate itself, but the machinery of government that turns policy into guidance. In government actions, the White House also issued further adjusting the tariff regimes for imports of aluminum, steel, and copper into the United States. That remains relevant because it continues to reshape trade treatment for core industrial inputs, with implications for manufacturing costs, supply chains, and customs enforcement. The administration also moved on personnel policy, with implementing schedule policy career in the accepted service. That action continues the broader effort to change how certain federal positions are classified and managed, with possible effects on hiring, retention, and management authority. Here is the story most people missed. The White House's vaccine document is likely to have ripple effects far beyond public health agencies, because any change in core childhood recommendations can influence insurers, school systems, and state health departments even before formal downstream guidance is fully updated.
What to watch today? First, whether HHS or CDC issues implementation guidance tied to the new vaccine document. Second, whether states or major medical groups respond publicly to the federal realignment. Third, whether the tariff changes trigger new statements from Commerce, USTR, or industry groups on metals pricing and supply. That is the Executive Lens for 2026-06-17. Sources in the episode notes. Back tomorrow.